Hi Mary, thank you for joining me today. I'm Teresa. I'm just following up with you from Dr. Tran's office here in Las Vegas. So these video follow-ups are kind of a new thing that we're doing for our patients that have a hard time coming in for follow-up visits. I know that you live outside of Pahrump. You're working full-time and taking care of your granddaughter full-time while your daughter is unfortunately in prison. So right now, we're just following up with some blood work and that you had done last time. So the one thing that your doctor is very concerned about right now is your kidney health. You had some numbers that weren't so great. You have some high risk factors for chronic kidney disease, including a family history of it. Both your parents passed away from chronic kidney disease. Just like chronic kidney disease, or also used to be known as chronic kidney failure, it affects a lot of people in the United States, around 20 million. So it's a very common, unfortunately very common disease that we have here. So a couple things that put you at super high risk is your uncontrolled hypertension and your uncontrolled diabetes. So those are a couple things that we're going to work with you on getting in check. I know you started some new medications, so the doctor just wants me to reiterate to you the importance of keeping up with your medications, staying on them, and if you have trouble getting your medications, please let us know, and we will work with you and find a solution for that, because it's very important that you stay on these medications. So first of all, let's go over what your kidneys are and what they do. So I'm going to show you a little black and white picture that I have of your kidneys. Hopefully you can see that. So these tiny little bean looking things, those are your kidneys. And they have a very important job. So what they do is they filter out your blood. They filter out your blood and they keep your fluid and electrolytes in balance, which is super important. We cannot live without them. So a couple things, I know a couple little symptoms you had. You also had, I noticed, an ultrasound because you were having some abdominal pain, which turned out to be, looked like a kidney stone. The pain seemed to go away, but that's something we want to keep our eye on too, because if you have a lot of those, that can also put you a high risk factor, or that can also, is a factor towards developing chronic kidney disease. So just we're going to watch out for that. So make sure, to avoid kidney stones, since we don't know what kind it was. We didn't get like a test, or you didn't actually feel like you passed a stone. Your symptoms just kind of went away. So just make sure you stay hydrated. Don't drink a lot of soda. And just make sure you drink a lot of water, and hopefully we'll avoid those. But there are some other factors that can contribute to kidney stones. But that's just something we're going to keep our eye on, and let us know if you have any more pain in your back or your abdomen for that. Now, about some of your numbers that we need to go over. So there's a couple things that we look out for when monitoring the patients for their kidney health. One of the earliest signs of kidney damage or signs that you could be developing kidney damage would be protein in your urine. So your last urine analysis, it showed that you had a little bit of albumin, which is a protein that's in your blood, and you had some in your urine, so that's kind of worrisome for us, so we're going to watch out for that. Another thing that we look out for with chronic kidney disease is your glomerular filtration rate and your creatinine levels. Now the glomerulus is the little portion in your kidney that actually filters out the blood and everything. So that is like something that we have to look out for. Now, To be diagnosed with chronic kidney disease, you would have to have three consecutive months of a glomerular filtration rate of 60 milliliters a minute or less, and elevated serum creatinine levels. So your last test, it shows here that your glomerular filtration rate, it wasn't that bad. It was, around 80 milliliters a minute. And your creatinine levels are about 1.5. A normal creatinine serum level is, for a woman your age, is between 0.5 and 1.1. So it's slightly elevated. So it's something we're going to keep our eye on to make sure it doesn't. So next month, we want to make sure it doesn't keep trending down and getting worse, that it gets better, or maybe next time it may be normal. Because those elevated levels, creatinine levels, could also be due to the fact that you did have a kidney stone. We don't know, but that's something we're going to keep our eye on. So now you know what your numbers are and what we're looking for. We also want to give you some more information of how you can get help and get some more information of changing your lifestyle and different things you can do to keep your kidneys healthy. So it shows here that you're still covered under the culinary insurance, and they do offer free classes all month long, every month. It's here in Las Vegas, but I know you do come visit your daughter, once or twice a month, so I highly recommend that you go to these classes. They have a diabetes class, cooking classes, and they have a class called Kidney Smart. So I highly, highly recommend going to these classes. They're free. You don't have to pay for them. And you can kind of plan that out, on your visits when you come see your daughter here in Las Vegas. So I'm going to give you the number for that. You're going to call 702-691-5665. And that number, they'll give you all the information so you can sign up for those classes. So I highly recommend doing that and take advantage of those free classes. So thank you for joining me, and please follow up with us. Give us a call if you have any questions, need more information, or you have any other concerns. So just remember to stay on that medication, get your diabetes and your hypertension under control, and it'll help keep your kidneys healthy. All right, thank you, and have a great day, Mary.